Yeah, I think we are live now, but that's okay.
Yeah, we'll be live in 5 seconds.
Oh, we are already live. We're also live on YouTube.
Yeah, cool.
But the screen that I have is not. Ashish? Ashish, put on the right screen.
This is the right one, sir.
Okay, cool.
Yeah.
So we'll start in the next minute.
Till down the screen, sir. थोड़ा सा till down. Okay. Laptop screen. Yeah. Okay.
What's the weather like there now?
But the last 2-3 days is better. I mean, we're getting those occasional rains, but it's cooled down and it's pleasant to go for a walk. Otherwise, it was quite hot and humid. So it's a little pleasant now.
Here in Bombay, it's raining most of the time. Sometimes that, on occasions, there's a respite.
Mm-hmm.
So it's been raining quite a bit.
I believe a lot of areas inundated over there with the.
Well, not as much now, and definitely not as bad as Gurgaon was a few days back. So
Yeah.
great. Shall we start?
Yes, sir. Good to go.
Hello and welcome to Health Live at Seniors Today. We are here right in the middle of the festival season. So if you hear some band baja at the background, please excuse me. We have here with us Dr. Sandeep Puri, all the way from Ludhiana. Of course, on cyberspace, it's not really on the way, it's very much here. A little about Dr. Puri. He did his MBBS and MD in medicine from Dayanand Medical College and Hospital and joined the faculty way back in 1992. He's held various positions at DMC, head of the medicine department, medical superintendent, principal and dean of the college, a position he's been holding for the last 6 years. He's also chairman, board of studies in medical studies, postgraduate at the Baba Farid University of Health Sciences in Faridkot. Dr. Puri was awarded the fellowship by the Indian College of Physicians, Indian Academy of Clinical Medicine, International Medical Science Academy, and membership of the National Academy for Medical Sciences. He's also trained in rheumatology at the AIIMS in New Delhi in 2002. He has supervised 35 theses, participated in 7 multinational clinical trials, and published over 50 articles in various journals and chapters in books. His service to the community has been by donating blood 93 times, and this is also to encourage the movement of blood donation. Welcome to Health Live at Seniors Today, Dr. Puri. It's a pleasure having you here.
Thank you, Pradhumanji. Thank you so much. And I'm delighted to be a part of this organization in this talk today.
So tell me, Doctor, you've supervised so many theses. You've done a fair bit of research work, etc. What is the balance like between research and practical, practicing of medicine?
Yeah, I think it's a very, very valid question and an important one. I remember one speaker who'd come here a few years back. He's a renowned person internationally. When he talked about the doctors of the duties of a doctor, he said a doctor can perform 3 things. One is that he can teach medicine. 2, he can see his patients in a good, proper manner. And 3rd, he can do research. So if as a doctor, you can accomplish and do one of these things in your life in a proper manner, I think you've done your duty. So doing all these 3 things together is a challenge, but I think God gives his blessings, the strength and the energy to do all these things. And well, so far I've held ground and I've been able to do a bit in all these things. And I hope I can continue the same way.
And what is the COVID scene in Ludhiana, in that part of the country, in Punjab? as such. We've been hearing a lot of stories that things were not all that great.
Yeah, I think we are now seeing the scare that you saw in Mumbai a couple of months back. There must still be so many cases occurring there, but the scare must have settled down. But we have gone into that scare mode right now in the last couple of weeks. We at DMC, where I'm working and where I'm the principal, we are a 1,600 bedded facility. And because of this COVID thing all over Punjab, we are probably the hospital in North India which is looking after the most patients. And at present, we've got close to 300 COVID patients right here in our hospital. So the number of cases are going up. Punjab initially was seeing a few cases. Now they're seeing close to 1,500, 1,700 cases per day. And we're touching a mortality of around 35, 40 per day. For a state of 3 crore population, I think that's a large number. So we're right now going through that scary phase.
Yeah, it is indeed very worrying. Some of us who are in the metros have been experiencing it a fair bit, despite the fact that we have some of the best of medical facilities. But anyway, let's move on to the session today. We are indeed, as I mentioned earlier, delighted to have you here with us to speak about hypertension and other issues concerning health of senior citizens. We have a large number of people who have gathered here to listen into you. I would request all of you to send in your questions, as some of you are putting in your questions. So please put in your questions in the Q&A tab, and we will have Dr. Sandeep Puri addressing them. Over to you, Dr. Puri. I think you have a presentation.
I've got some slides. I thought we can kickstart the program with a certain prologue.
Sure.
Yeah, could you move back the slides? I think we were just checking onto it. Yeah. So, I'll just spend about 7-8 minutes on these slides before I can answer all your questions and queries. The focus is, all of us want to maintain a healthy lifestyle. And as Pradhumanji wanted that we could be talking a little bit about hypertension. So it's an age-old saying that you only live once. I feel it's false. You actually live every day. You only die once. Next. Can I have the next slide, please? Yeah. Look at this. These are the oldest living persons ever. Jean Clement, Sarah Noss, Lucy Hannah, Mary Louis, and Maria. Well, can I have the next one? Did you notice anything peculiar in this slide? Next one, please. Well, all of them are females. So the females have a more longevity if you look at this data which is there. Can I have the next one, please? Well, the progress which has been made in lengthening the lifespans and postponing senescence is entirely due to medical and public health efforts, a healthier nutrition, the rising standards of living, better education, and more salubrious lifestyles. Next one, please. We'll have the next. For those of you who are interested into knowing as to what is the quality of life that I should lead to be living very long, well, these are the places where you've got, there are 5 places in the world which have been identified. Okinawa in Japan, Sardinia, Loma Linda in California, Nicoya in Costa Rica, and Ikaria in Greece. These are the places where the longest living people reside. So for those of you who want to go and Google search, you see the lifestyle of the people over there, and maybe you can follow it for your own healthier lifestyle. But have the next one. So the secrets of longevity, some data from these areas found that they had widespread gardening, which provided an opportunity for exercise, sunlight, nutritious food. There's an adage which says that eat until you're 100% full. Don't make your stomach 100% full. Limited or no consumption of refined sugar and other processed foods. Maintain a healthy weight. Alcohol, well, try and avoid it. Have a sense of purpose, a positive close social support groups, have time for leisure, sense of humor about life, have an adequate sleep. 8 hours of sleep is considered the best. I don't know how many of you would be having that kind of a sleep. And of course, you can thank God if your genetic factors are good, if you've been passed on good genes, but you don't have to curse him if they're not good. I think we can skip this. It's almost the same as the previous one. If you look at the health concern in the 40s, the diabetes, hypertension, about which we'll talk about and answer questions today. If you've got deranged cholesterol and triglycerides, we call it dyslipidemia. If your weight is on the obese side, osteoporosis sets in. Our maximum peak bone mass actually is at around the age of 30. So if you want to maintain good thing, or if you want your children and grandchildren to have healthy bones, ask them to exercise till they're 30. After that, the decline continues. Then pain like arthritis, back pain, these all things set in the 40s. And of course, you might be into that midlife crisis and you might be facing stress. Next one, please. As we go into the 50s, you get on top of it the heart disease, which we call as the coronary artery disease. Some unfortunate people get a stroke. There are various cancers, breast, prostate, colorectal, cervical, skin, that can be seen in the 50s. Your prostate tends to get hypertrophied. Females will be reaching menopause. Hair loss in men and women can be disturbing, and some people can have fat problems. Next one, please. As we go into the 60s, apart from all the concerns that you've been having in the 40s and 50s, your general physical and mental health tends to decline further. There could be financial issues. A person tends to become dependent on others, and that's how life goes on. Coming to hypertension per se, hypertension is a silent killer. Most of us kind of deny that we've got high blood pressure. The only way you can recognize high blood pressure is by getting it checked regularly. If you're not having any symptoms, does not mean that your blood pressure is normal. Next. Uncontrolled hypertension can cause premature death. It increases the risk of your heart attack, stroke, kidney failure, affects your eyes, can cause blindness, and there can be other complications. If your blood pressure is more than 20 millimeters from the normal, it actually doubles the risk of these problems at an early age. Most people with high blood pressure do not know they have it. 1 in 4 men tend to have hypertension, and 1 in 5 women, they tend to have hypertension. We need to diagnose it early. The only reason we need to diagnose it early is to prevent all these complications that come through. Hypertension is rarely accompanied by symptoms. Nearly 70 to 80% of people who have high blood pressure or hypertension would never have symptoms. The identification is through screening or when you seek some kind of a healthcare advice for an unrelated problem. But you need to know that there are some symptoms which can give you an indication that your blood pressure may be high. A proportion of people with high blood pressure would report headaches, lightheadedness may be there, vertigo, tinnitus, which is a buzzing sound, a kind of a sound which can you hear in your ears. Visual disturbances could be there. Some people can have fainting episodes, nosebleeds, and the moment you have a nosebleed, you tend to run to a doctor and you think that your blood pressure would be high. Some people would tend to have paralysis of one side of the face. So these could be there. Grab the next one. So this is what I just said before. So we don't treat hypertension or diabetes for the sake of treating it. We want it to be optimally controlled to prevent any kind of a damage occurring to your heart, to your brain, to your eyes, to your kidneys, to your blood vessels. Next one. It's a frequently asked question that I am so old. Previous one, please. Yeah. So I am 60 years of age or I am 70 years of age. Is my blood pressure of 150 by 90 normal? Well, A normal blood pressure is 120 millimeter systolic, that's the higher upper one, and 80 millimeter mercury, that's the diastolic one. Anybody who's got a blood pressure between 120 to 129 at any age, or a diastolic pressure which is more than 80, it should have been written more than 80, is an elevated blood pressure. And hypertension is when you can have it in two stages. Between 130 to 139, that's up till 140 is a stage 1, and between 80 to 89 is stage 2. Once you've been diagnosed to have hypertension, your caregiver, your doctor might give you two options. One is a non-pharmacological option, and the second is the pharmacological or the drugs that we tend to take. Next. Grab the next one. Yeah. So amongst the non-pharmacological, which is going to be the concern of most of you, how can I control my blood pressure without kind of taking pills or drugs? So salt restriction is the most, could I have the previous one? Yeah, salt restriction and supplementing your diet with potassium, that is with fruits, trying to maintain an ideal weight. You can notice the dietary approaches to stop hypertension. DASH is a form of a diet. It's more of a Mediterranean kind of a diet, which can lower your blood pressure by 4 to 6 millimeters of mercury if you follow it. Exercising at least about 40 to 45 minutes, at least 5 days a week, could bring down your blood pressure by 6 or 3 millimeters of mercury. And limiting of alcohol intake. Next one. Well, these are some things which I just mentioned in the previous one, and these are the figures on the right side. I'm sorry, it's not a very clear slide coming through over here, but you would recognize that most of these parameters, like restricting your diet, going for an exercise, limiting your alcohol, maintaining a healthy weight, all of them would contribute to bring your blood pressure down by about, say, 10%. But if your blood pressure is really high, you need to take pharmacological medicines. Next one, please. So high blood pressure can be controlled, follow medical advice, adhere to lifestyle changes, take medicines as they are prescribed, get your blood pressure checked regularly. Next one, please. Reduce your salt intake to less than 5 grams, eat fruits and vegetables regularly, avoid any kind of saturated fats, and avoid tobacco, minimize or reduce alcohol intake, and be physically active every day. Well, a healthy lifestyle is not just about what you eat, it's also about what you consume, whether it's emotionally, it's mentally, and it's spiritually. Well, this was just a short presentation, which I thought would set the ball rolling and give a little overview about what exactly high blood pressure is. I'm ready to answer what questions and queries you would have.
Thank you very much, Dr. Puri. Excellent presentation. I think you have, in a sense, answered most of the questions that people would have. But be that as it may, we have a few questions. I'll take one from Deepak Desai. Well, it's actually from Kamini Desai. Kamini, my age is 62, female. While climbing the staircase, I feel tired and fast breathing. Experience fast breathing. Is there a remedy to reduce or cure?
Yeah, definitely. I mean, whenever you have any kind of a symptom, we have to find out what the cause for it is, right? And at the age of 62, apart from what the things that you talked, the first and foremost thing that I would like to rule out is what is your hemoglobin level. Because these symptoms, the tiredness that you're feeling, the palpitations or the increased heartbeat that you're feeling, which is occurring on exertion, the first thing that one would like to rule out is what your HB hemoglobin levels are, if you're anemic. Second, what is your normal level of exercise? Are you leading a very sedentary lifestyle, or are you very active? You go for your routine walks, you do some kind of a yoga, all these things. If you've been doing that and you've started feeling these symptoms now, you definitely need to get yourself checked out. Apart from low hemoglobin, yes, you would look for any kind of a high blood pressure that may be there. Everything is treatable, but it would depend upon what exactly the reason is. If low HB is the cause, just correcting your hemoglobin is going to make you feel perfectly fine.
Thank you. We have a question from Jyotsna Karya. says, when should one go for the ambulatory BP test?
Okay, that's a nice question. Ambulatory BP monitoring is something like you have a machine which is put onto you, and it continuously monitors your blood pressure at frequent intervals every 15 minutes or so. So you have that machine onto your body for 24 hours, and thereafter it gives you the reading. Now, there are some people who tend to have a very labile hypertension. They would come to you that, yes, my blood pressure just shoots up and then it suddenly drops. Some people are taking medications. They're going to their doctors, and the doctor would find that his BP in the morning is 180 by 100, and in the evening it drops to 90 by 70. Then there's a third set of people who might be suffering from a particular disease. We've got a disease called a pheochromocytoma, that is of the adrenals, which produces wide fluctuations of BP. So if on your routine monitoring of blood pressure, supposing you're monitoring it twice or thrice a day, you do it in the morning, in the afternoon, in the evening, and over the period of 3-4 days, you find that there are wide fluctuations into it. That's the time when you would like to do an ambulatory BP monitoring. Secondly, there are people who come into your clinic, and we call it as a white coat hypertension. They enter the clinic and their blood pressure kind of shoots up. But they say that while they're at home, your blood pressure readings are more or less normal. These patients, again, they might need an ambulatory BP monitoring, which would confirm whether their baseline pressures are normal. So primarily, wherever there are wide fluctuations, or if you've got a high blood pressure that is not being controlled optimally by using quite a few drugs, then your doctor might want you to do an ambulatory monitoring.
We have a question from Purnima Kiruskar, who says, my mother is 57. Since this COVID-19 situation has started on various occasions, her BP shoots up abruptly. Is it a kind of a heart-related situation? Is there any particular eating habit that she needs to follow? As per the doctor, we have reduced her salt and sugar intake. She follows her medication properly. Please advise.
Yeah, I think diet, as we said, is the cornerstone. I mean, you'll have to be kind of careful at times if your doctor has prescribed diuretics and this weather is a humid weather in which you tend to sweat. Some people, they tend to get low sodium levels. So you have to be careful as to how much of salt restriction that you're doing. Do not make salt zero into her diet. A normal person requires around 5 grams of salt. So bring it down to something like, say, 4 grams of salt per day, which should be adequate. The rest of the BP should be taken care of by other measures like walking and taking ample fruits, and then, of course, your medications. I don't see it as a matter of great concern, but if there are some fluctuations, I mean, be sure that she's not stressed up. I mean, COVID has been a stressful situation. We don't have definitions of COVID depression coming in right now, but I'm very sure in the next few months and years, we will have people, psychiatrists, living that anxiety and stress definitely has built up in the COVID times, and it is contributing towards fluctuant and high blood pressures. But yes, if there are wide fluctuations, preferably examination should be conducted. But at home, what you can do is monitor her BP, make sure she's taking the medicines at a regular time, make sure what she's following in the diet, and she's kind of avoiding all these high salt intake foods, the pickles and poppers and chaats that we tend to at times consume. Because a lot of people have been into cooking these times, and we've got people who've developed a passion for cooking, and I'm sure she must be a good cook, and if she is treating herself to some more delicacies, that could be one reason for it. That's just on the lighter side.
Thank you, Doctor. What is your view about, you mentioned about the salt intake which is there now. There are a host of things which you get in shops, whether they are the salted namkeens as they're called, which wafers or whatever else, which have a huge salt intake. So how much should one have of of those products?
Again, I mean, if you go by what I just quoted in one of my slides, the salt intake should be 5 grams per day, right? A 5 grams would be one level teaspoonful, not a tablespoonful, a teaspoonful of salt, which you're going to take in the entire day, whether it's in your vegetables that you cook, whether it's in the snacks that you eat or anything like that. Now, these are all concealed salts, right? You put it over your salads. You have a pickle along with when you're eating your food. You've got that nice sleazy papad over there. And if you're sipping that hot cup of tea in the evening, you tend to have these beautiful namkeens which are available. But let me tell you, all of them contribute to an increased salt intake. And that is where one has to put the line. You have to restrict that salt intake if you're a hypertensive. And if you're uncontrolled, it's even more important to look at these things, because when you talk about uncontrolled, there are people who would be taking 3 or 4 pills of high blood pressure and still their blood pressure is not controlled. So the common things, if they're taking anti-allergic medication, if they're taking painkillers, and third, of course, is when we do a recce about the diet that they're taking, and it'll come through that they're taking actually some things which are rich in salt and is contributing to your high blood pressure.
Thank you. We have a question from Anand K, who says, my blood pressure is under control, 110/70, with half telma, AMOD. I have reduced my weight by 6 kgs. Can I stop my medication, or how do we decide when to stop my medication? Any precautions I need to take?
Well, the ideal blood pressure is if it's less than 120/80, then we have to see what are your risk factors like. Did your parents or your siblings, did they have any kind of a premature heart disease? When I say premature, if a male member less than 60 years of age or a female member less than 55 years of age in his lifetime has had a heart attack, it's considered as a premature. It's considered as a strong family history. So if either one of your parents or your siblings has had a heart problem at less than these age groups, then your family history is strong. What are your lipid parameters like? I'm sure if you're a hypertensive, your doctor must have gotten your lipid parameters done. If they're not kind of very offensive, very bad, and if they're managed and if they're controlled, I would like to maintain your blood pressure at 120/80 or lower than that. 110/70 is perfect. You can, because telma-am is a combination of 2 salts. It's got telmisartan 40 mg and amlodipine 5 mg. So you're taking half of that tablet. So virtually what you're taking is 20 mg of telmisartan and 2.5 mg of amlodipine. So you can possibly switch on to a single dose, that is telmisartan 20, and see if your blood pressure. But if it kind of shoots up, if it is going beyond 120, then it'll be better that if you just continue with it. These medicines are not going to harm you in the long run.
Okay, thank you. We have a question from Sangeeta Kedia, who says, is common salt or rock salt? What would you advise?
Well, there are some studies which quote that rock salt is a shade better than the common salt. But if so in medicine, what we talk about is evidence-based medicine. The 2 types of medicine which are practiced now, one is evidence-based medicine, one is precision-based medicine. So over these years, as we live, precision-made medicine would take over. But what do you mean by evidence? Evidence means that you show it. You give 1,000 people common salt and you give rock salt to 1,000 people and you prove those benefits. That is how one can say that this one is superior to or this one is not inferior to A versus B. As of now, there is no final diction that we tell our patients that, okay, you should take rock salt or something. Companies do promote it. There are a lot of ads which come onto the TV. They are, uske piche wo bol dete hain ki bhi doctor ki se pramanit or something like that. Those kind of figures are there. But I seriously believe that we need evidence. So there are some people who say that rock salt is a shade better than common salt. But both of them, the lesser, the better it is.
Doctor, as an aside, I must ask you, your when I was reading information about yourself, I noted that you have participated in clinical trials.
Right.
We've been hearing a lot about clinical trials uh, uh, happening with the vaccine in Russia and the Indian vaccine that is going to be there. So, could you throw some light on what is the process of clinical trials? And since you've been part of many of them.
Yeah, so I mean, clinical trials, they go through various phases, right? You have a phase 1 clinical trial, then you have a phase 2, then you have a phase 3. So the initial phases of any new molecule, any new drug which is being tested, it's usually carried out in animals. Subsequently, once they find out that these things are safe, then they come on to human trials. So the initial trials, which are phase 2 trials, when they're carried out in humans, they have a very robust kind of an infrastructure to back them up. So their profile of how to use the drug, what effects to note, what side effects to note, the compensation that they would offer to people who willingly participate, it's a very strong and robust system. I mean, we've read negative things about clinical trials, that the trials, the compensation which is given, that Western companies have come into India and they conduct trials. Let me tell you, there are equal number of subjects, they know their rights and they participate in the clinical trials in the true manner. Most trials in India are usually done in the phase 3. So phase 3 is where a molecule has been found to be relatively safe in human trials. And now they're doing it on a larger population subgroup. And then they're seeing as to whether this is kind of efficacious. The dictum in medicine is first do no harm. So whatever you're going to do, whether it gives you a benefit or an advantage, that's secondary. First of all, it should not do you any harm. So whenever these clinical trials are done, so the details are so significant and so elaborate in the trials that we used to do. I mean, if I have to do a particular trial in one patient, it will take me at least, say, about 60, 70 hours of input, about catching all the details, maintaining all the data, feeding it into it. And subsequently, they kind of analyze these details. So as far as the vaccine is going, yes, because it's something very rare. It's about after 100 years that such a pandemic has occurred that has brought this world to a standstill. The people are in a hurry. So they are kind of pushing these phase 1, 2, and 3 a little more quicker and hoping that it would come through. But yes, the system of conducting a clinical trial, it's absolutely robust. And if it is followed properly, there is no chance. I mean, they would terminate a trial early if you found that this medicine is not benefiting. Then you would terminate this trial. If you're comparing two medicines and you find that A medicine is benefiting the patients much more than the B medicine, they would terminate that trial. They would say that once there is so much of benefit coming from one, there's no need to try the next one.
Great. Thank you, Doctor. There are several questions that have come in. I think I must not digress. Yeah. There's a question from Katie Dadanchi, who says, Doctor, the minute I enter a doctor's clinic, my BP shoots up with palpitations. And once I'm at home, it comes back to normal. What should I do? I'm 69.
Yeah.
Is there any medicine to control this?
Yeah, I think I just mentioned in that short presentation that I heard earlier. So that's what we call as the white coat hypertension. Not that all doctors do wear white coats in their chambers in their clinics today. In our hospital, we do tend to wear those white coats. So that's the term given, the white coat hypertension. And well, it does happen with so many of my patients that I take their blood pressure. It's so high. They'll say that whenever I'm at home, my blood pressure is absolutely normal. So I do respond, I'm not that scary, and I can joke with you, so you don't need to be scared. But I guess it's a natural thing and it's recognized. It's a medical term which has been given, that is white coat hypertension. We'll give importance to your blood pressure readings at home. If those readings are normal, then you need not go by the figures that are recorded in the doctor's chamber. Go by the figures which are there, and your doctor will tell you that please take your figures and bring those readings to me. I'm going to treat you according to that.
We have a question from Gucci Ram Sarma Rampali. I'm sorry, I don't get your the pronunciation of your name right every week. Who says, I'm 71, male, healthy, physically active, eat cooked food once a day with fruits diet at night. I was showing slightly higher BP earlier sometimes, was prescribed a tablet, took it 3 years before I switched to a single meal and fruits. I have a feeling that my BP is normal. How to be sure? I was not, I was asked not to stop medication.
Well, I think the only figure is your blood pressure reading. We do get people who adopt a very stringent and very strict kind of a lifestyle. It does lower their blood pressure. So the optimal thing is what your blood pressure readings are. If you've stopped your medications and your blood pressure is normal, if it's not going beyond 130 by 85, that's what I would suggest. Beyond 130 or 85 is something which I would like to treat. Then you are safe. You don't need to think that I was on medicines and how I've stopped it. It does occur. It does occur in quite a few people that once they adopt a very good and a healthy lifestyle compared to what it was earlier, their BP medications get stopped.
Thank you. We have a question from Devendra Gada, who says, my question is blood pressure related to any organ or anything else?
Very relevant question. I mean, hypertension. So first of all, I mean, whenever a person walks in, I tell him that you've got hypertension. वो कहते हैं जी मेरे को तो कभी tension रहती नहीं है. So you have to distinguish anxiety and mental agony and stress from hypertension. So hypertension essentially is high blood pressure. And we classify it into two types. One is a primary and a secondary. Primary or essential or idiopathic, these are terms which we interchangeably use. That's the blood pressure, high blood pressure in more than 90% of these subjects. 10% of people would tend to have something what we call as a secondary hypertension. So secondary hypertension means that your blood pressure has gone up because of some disease within your body. There are some people in whom their blood vessels, they kind of become very tight. There's some kind of a vasculitis. There are some people in whom their renal blood vessels, the arteries which supply the kidneys, they kind of get narrowed down. So that is known as renovascular hypertension. There are some people in whom there is increased secretion of steroids from within, right? You all notice that people say that steroids nahi khane chahiye, side effects hote hain. Well, our body itself secretes steroids. It's essential for our body to maintain them. If they're low also, we can be diseased. So if you've got excess of steroids in your body, which we call as a Cushing's syndrome, that also can produce secondary hypertension. So one of the causes in which you're taking medications and your blood pressure is not getting controlled makes us suspicious to, look for causes of secondary hypertension. Then in very young people, people less than the age of 25, if they get a high blood pressure, we always look for these causes because they are potentially treatable. I mean, you might treat that renovascular hypertension, dilate that artery of kidneys, which is constricted, and you may not need to take any medications. So you're right that 90% of people have idiopathic, that is something the cause of which is not known, but 10% of people would have a secondary hypertension, and there is a host of causes. I've just enumerated 3 or 4 of them, but there are at least about 15, 20 other causes which can be responsible for high blood pressure.
Okay, we have quite a few questions coming in. I must confess, I don't know when to ask all of them, but there's a question which is, again, very specific question. I'm 69 years old, a retired officer. There are times when out of the blue, I find myself flushed and experience a sudden drop in energy so that I'm unable to sit comfortably. But after drinking some water and perhaps some lemon juice with sugar, my energy is regained. This rarely happens, but it does. And should I be concerned about it?
Yes, at the age of 69, definitely, if you're having these kind of episodes, one should get yourself checked up. If you're not on any medications, or if you're on medications, either ways, you need to get a cardiac checkup done. Sometimes there can be rhythm disturbances. Sometimes your heartbeat might be slowing down, or it might be increasing disproportionate to what a normal heartbeat is like. And under these circumstances, you can have these kind of symptoms. It's not sure that you'll have something. It could just be something without any particular reason. But yes, at the age of 69, if you're having these symptoms, I would suggest that you should get a cardiac checkup done.
There's a message which has come from Mr. Ravinder Singh Kohli, who says, मेरी sister जो 59 years की है, उनको कल रात एक आंख एकदम रेड हो गई, जैसे कि उसमें ब्लड ही निकल जाएगा. डॉक्टर ने उन्हें आई ड्रॉप दी और उन्हें बोला कि हाई बीपी की प्रॉब्लम है. माय क्वेश्चन इज what should one do for this?
Yeah, so what you had is a conjunctival hemorrhage, right? The white portion of your eyes, that is the conjunctiva, and sometimes bleeding, some blood vessel bursts and you tend to have a bleeding in the conjunctiva. Similar kind of a bleeding can occur through your nasal cavity also. So whenever there is an abnormal bleeding, high blood pressure is one of the reasons for which this can occur, but that is not the only reason. There could be other diseases in which your blood coagulation is disturbed, because of which such kind of a bleeding can occur. But yes, if your hemorrhage occurred and if your doctor noticed that your blood pressure was high, one would optimally treat that blood pressure depending upon your age and your other comorbidities and your clinical condition. One will select which is the best medicine and what is the best dose for you to start it off. But yes, at the same time, if you had a bleeding in your eye, I would tend to get some other blood investigations also done, which will rule out that you're not having any kind of a bleeding disorder which has manifested as a bleed in the conjunctival area.
Doctor, I know we are running out of time, but I'll ask 2 or 3 questions, 2 concerning hypertension and 1 a general one. The first question is from Puneet Vengankar, who says, Doctor, I'm 72 years old, fit and fine, had an angioplasty in 2009, first and maybe last. Being a sports person, had managed my activity in spite of huge financial breakdowns. Which test or follow-up checkup should I do? Is an angiography needed?
Well, I am sure that your cardiologist must be doing a routine checkup, whether it's an annual affair or he does it every 2 years. So there are some basic parameters in your blood tests and all that you need to go through. If you're doing a good bit of physical exercise and if you're not getting any symptoms like chest pain, symptoms like getting out of breath, symptoms like sweating, which could indicate angina, well, I presume that you're doing fine. You need not go in for an angiography. You can actually get some other investigations also done, which are sort of an angiographies, of course, are of 2 types. You know, there's a CT angiography, which is done, and then there is a normal routine kind of a coronary angiography done. But for this kind of a thing, myocardial perfusion scans are also done, which are equally, I mean, they're not as cumbersome as an angiography is. So you can get the perfusion scan done, which your doctor would advise. And if you do it now, and if you're asymptomatic, you need to repeat it maybe after 5 years. Or your doctor might just say you get a treadmill test done, because that would also give you a fairly good idea how your coronary muscle, heart muscles are doing.
Okay, and there's one question from Dr. K. Srinivasan, who's 75, and he says, I have a kind of a rhythm disturbance. I'm taking beta block as per the doctor's advice, who advised me to take till night. I'm also taking a sleeping pill, 2 mg every day since many years. I do yoga, I'm able to sustain. Will there be any further escalation, please?
So I got the point that he's taking beta blockers, there's sleeping pill and there's yoga, but I missed out on the first mention.
He has a kind of a rhythm disturbance. And he is So let me just repeat. He's
Yeah.
age 75. He has a kind of a rhythm disturbance. Is taking beta block as per
Okay.
doctor's advised, who has been advised to take it till life. He's also taking a sleeping pill of 2 mg Ativan every day since many years. He's doing yoga. He's able to sustain. He just wants to know, will there be an escalation uh, uh, in the future?
Right. I mean, once you're taking beta blockers, obviously you've got some form of a tachycardia. There are various kinds of tachycardias which can occur. So I'm sure your doctor must have told you about that. Normally, if you're following this kind of a healthy lifestyle and you're taking your medicines regularly, you're monitoring the blood parameters regularly, uh, at the age of 75, there is very little chance that you should have an escalation in your symptoms or in your doses. But we all go through a natural process of aging, which we can't stop, which we can't yes, we can de-escalate it by maintaining this kind of a healthy lifestyle, but we definitely can't stop it. But the way you're mentioning, the kind of lifestyle and the yoga thing that you're doing and you're taking your regular medications, I'm sure you're going to do fine and you shouldn't be worried about it.
Thank you, doctor, for all the responses on hypertension. We have a general question that has come in from Neelam Sethi, which is of interest to a lot of people, I guess. Why are we facing a lot of hair fall these days?
Hair fall. Yeah, that is one of the things that I mentioned in the 50s. That is one of major concern. And now that there are so many hair transplant centers which have come up and they're doing thriving business. So all those people who say कि भी कुछ नहीं होता अगर बाल झड़ भी गए तो क्या हो गया, but yes, that is a concern. I guess hair fall is linked to quite a few things. It can be linked to your lifestyle. It can be linked to your food habits. There are some particular vitamins, particularly biotin, which is helpful in maintaining the growth of your hair. So if you're deficient in biotin, now don't ask me what are the sources of biotin, because there are not too many sources of biotin. I mean, if you're eating a good, healthy, balanced diet, that would work. There are theories that deficiencies of calcium and vitamin D also can contribute to this kind of a hair fall. So all that I can tell you is that have less of stress, drink ample amount of liquids and water in your day, consume a diet which has got ample amount of all these vitamins and trace elements. So kind of consume all kinds of vegetables and fruits and pulses, legumes. Of course, calcium products, which will come through in milk and other dairy products. So that may help it. But if you're still experiencing a hair fall, you can take biotin supplements through medicines. Not to go away from that point, there are certain diseases also which can have hair fall. Or we call it as alopecia. There are certain infections of the scalp or any other particular area of the body which can cause hair loss. There are diseases like lupus in which there is hair loss. So if it's only hair fall without anything else, it could be related to your diet, your stress. But if it's particularly bothersome, and if there are any other associated symptoms in your body, you need to go to check up with your doctor. You might find some other ailment there.
Thank you very much, Dr. Sandeep Puri. We have several questions, some very detailed questions from Vijay Patwa, Devendra Gara, Monchi, Isaac, Joseph Fonseca. I'm really sorry that we are not able to take all these questions, but thank you very much for being here, Dr. Puri, spending all this time and patiently answering all the questions. And thank you, all of you, for being here. We have the presentation that Dr. Puri gave earlier. We will have that as part of the takeaways, which we put up with the recording of this Q&A. So we will have that on Monday morning on seniorstoday.in. So please look that up. We have had an amazing response today, and I know it's a festival day and a holiday in many parts of the country. But thank you all for being here. And thank you, Dr. Puri. We have...
Thank you, Prademaji. Thank you very much. And thanks to Mr. Vikram Sethi also for bringing me onto this platform. And it's really wonderful interacting. And I'm sure that whenever any one of you who's been to this seminar is visiting Ludhiana, please do drop in. You're most welcome.
Thank you very much. We have another session of Health Live at Seniors Today next week. Next Saturday, so please be there. I must remind all of you that tomorrow at 12 noon, we have our regular session, the fun and frolic session of which we do every Sunday at 12 noon. Tomorrow is a Bollywood bingo. So you, if you think you know a fair bit about Bollywood, you would like to have a housey-like game on a Sunday afternoon. So do join us tomorrow at 12 noon. And thank you for being there. Thank you once again, Dr. Sandeep Puri, for being.
Thank you so much. Thank you. Thank you. God bless you. God bless you.